Hey Jody, good morning.
Oh, sorry. Good morning.
Hey,
Morning, Jamal.
hey Ryan, good morning.
How
Welcome.
are you? Thank you, sir.
Y'all have some nice Thanksgiving plans coming up.
Well, I mean, Jody's here. I see Jody. I'll let Jody go first.
We're just staying home, but it's my favorite place to be on Thanksgiving. I don't need the travel during the holiday, I guess.
Right?
And
Same.
ironically, I'm going over to Jody's. I'm just kidding. We're
There
staying
we
home
go.
as well.
Awesome.
Does E2108 also go by Mrs. Chelsea Hammers?
Yeah, I can't believe you didn't know my employee ID number, Ryan. Come on.
It's been a while and my memory is fading as I'm aging, but I appreciate your confidence in me.
I mean, you do have a high IQ, so
Wait, did somebody say that Ryan had a high IQ?
Yeah,
that's what he tells people, Diane.
It's measured in the-
Oh, okay,
it's
okay.
measured in the thermostat aisle at Lowe's, actually. It's like that room temperature rating, that's right there for me.
You're
I feel
so
like we've
funny.
got a little reunion going on here.
I know, I was like, you didn't know what you got yourself into this
I
morning, did you?
know. I know. What happened?
All right, I see Lisa's joined. Welcome, Lisa.
Good morning. You look lonely in that room. That's an awful
I
big room for
am.
one person.
I know, we might have to start having some in-person meetings or like hybrid, it's just too empty in here for me.
On my way, Jamal. I'll be there in 10.
Perfect. All right, Bruce is joined. Hey, Bruce.
Good morning, everyone.
Chris and Lindsay with OHSU and Kurt, thank you so much for being with us today. And Bruce, I think we'll give it another couple minutes here for folks to join. See if we can get up to a good quorum, even though I don't think we've got any voting matters today, but we'll give it a couple more minutes.
Totally agree.
And Christina's joined, and Caroline, Manu, good morning to all of you. Good morning, Carlos.
Morning.
good morning.
A delayed good morning from me as well.
Hey, Manu. This is joined. Okay, Bruce, I think we've got a good group here if you want to kick us off.
Well, Jamal, we always have a good group, don't we?
I stand
Well-
corrected.
Well, I want to thank everybody for joining us today to our clinical advisory panel. We are having our meeting today, November 26th of 2024. Jamal, I would like to start us off by recognizing that we are a publicly open meeting. Therefore, I would like to see if there were any public comments to be made before we do some of our announcements.
Yeah, and Bruce, while we're waiting for public comment, I did see that Kurt had a comment in the chat. So Kurt, we will be able to let you screen share here.
That's great, although I didn't actually type anything in the chat, so I wonder what showed up.
Sorry,
It was me. It was me.
So a reminder, we do have a very packed schedule and we are going with the old school. Please go ahead and put your name and the organization that you do represent into the chat today. That way we can go ahead and mark you down for your attendance, which we really appreciate. And then Jamal, I think you and I had talked about a couple of announcements. Do you have that special slide ready so we can kind of go through some of those announcements?
Yeah, Bruce, I'm gonna have us wait until after Kurt and Lindsay's presentation because I know that they've got I believe an 8:05 that they've got to get to eventually.
Okay.
So we'll come back to that at the general cap updates section. But I do, Jody Peterson with Salem Kaiser School Districts has an announcement or a request for the group.
All right, let's hear what Jody has to say.
Hey guys, sorry I'm on my phone with no major computer or my face. So sorry about that, just with traveling this morning. But I just wanted to put some information out there. We have athletic trainers at Salem Kaiser Public Schools, and they support our athletic programs. Obviously, it would be the best for them, but they really are wanting to ask the community. Prior to the pandemic, they had some providers that wanted to support them on sideline of football games mainly. And when they did that, it's usually somebody that either had a child or a community member or had a passion with football and Salem Kaiser had a connection, and they're really they asked me to bring it to any community group I possibly could of any providers that ever have that passion and it doesn't have to be an orthopedic provider. They're really looking for any MDDO, PA, NP that would support an athletic trainer who is master prepared on the sidelines at football games on Friday nights. I know we have another season that's just wrapping up, but I wanted to throw that out there. They would be a volunteer position, and they're also struggling with our community with post-concussion. The return to play OSAA rules and state laws have our kids needing to be seen post-concussion, and just some work around that too. So I know that's like a big ask, but it's something to like lay on the table and maybe we can process as we come into another football season. And if you guys have any colleagues or friends or other providers or asking just a good way to get this out to our community for Salem Kaiser, I would really appreciate it.
Thanks, Jody. And Jody, feel free to put some information in the chat or your contact information. We can also follow up after the meeting with any information we want to share with the group so folks can kind of mull over that with their colleagues.
Thanks so much. I will do.
Absolutely. Okay, Bruce, I do see that we do have a voting quorum today in case there's anything that the group would like to vote on as we move forward. And with that, I will turn it back to you.
Okay, well, it's pretty quick. We're going to move on over to looks like Kurt Freeman and Lindsay Blankenship from OHSU. We're very excited. They're going to come in, talk to us about their autism assessment capacity project, a project that we here at the CAP are very passionate about. Those of us in particular, individuals that feel that the IDD community could use much more attention and love, and for this we are truly grateful. So I believe we're going to turn the time over to Kurt and Lindsay at this point, Jamal.
Yep. Kurt and Lindsay, welcome. I'll turn it over to you.
Great, thank you. Thank you all so much for having us this morning. I really appreciate the opportunity to share a little bit more about the work that we're doing and how it may align with goals for your community, and to answer any questions that we can. This, of course, doesn't have to be the only conversation, but it's really an opportunity for us to share some information and see how we can continue to explore partnerships. So I am going to share just a few brief slides to orient people to the work that we're doing and what we're hoping to talk about. Let's give me just a quick second here. If somebody could just verify that you're seeing this, that would be great.
I can see it.
Great. Let me put it into show mode. Okay. So we're here representing multiple organizations that have been working on addressing what really many of us consider a crisis in access to diagnostic services when there is a child identifying as potentially demonstrating autism spectrum disorder. This work that we've been doing is a multi-organizational, started in the Metro County area, and we've been working on several different arms of this effort to address the crisis. One of them, which we'll spend time talking about today, is engaging in training for primary care providers to improve their readiness to provide diagnostic services within the primary care home. So this is the steering committee of the group that has come together. So we have representatives from OHSU, Providence, Legacy, the Children's Alliance, Health Alliance, excuse me, Care Oregon, and our project has been funded by HealthShare to this date, and that's why it's been a largely metro driven effort. The project that we are talking about today is work that we've been doing to train primary care physicians, as I said, to deliver the diagnostic services. When we developed that and started advertising for that training, we actually advertised it only in the metro area because of HealthShare funding. But word quickly got out, and we had inquiries from across the entire state for requests to be able to participate in the training. So this is an effort for us to take this wonderful momentum and try to bring it to other parts of the state, because we know that this is not a metro only issue. So that's what we're going to talk about today. So this work is based on really solid evidence from other states that have been doing this kind of training for primary care providers for multiple years. What we've seen through the research in this kind of effort is that when primary care providers are trained to do diagnostic evaluations, we are able to identify youth at a much younger age. So the studies that have been done in other states are demonstrating an average age of diagnosis of 30 to 32 months, where in Oregon, the average age of diagnosis at a specialty center like ours up here at OHSU and Legacy and Providence is at about 4.5 years of age for the child. The research has also shown that it markedly reduces wait time for that diagnostic evaluation to about 1 to 2 months, rather than what can often be a 6+ month wait to see a specialty center team. There's also really good evidence that shows PCP delivered diagnostic services has really high inter-rater reliability with what we would consider gold standard team-based approaches to doing this work. We also know that when primary care providers do participate in this training, they have good uptake. Those PCPs tend to do 1 to 2 to or 4 to 6 per week, all the way down to 1 to 2 per month. But that's a significant reduction in the number of patients that need to be referred to a specialty center like ours. And then there was a recent study published, I forget in which journal, it might have been Pediatrics or JAMA, honestly, I can't remember, but that really showed that when youth are who are identified as being at risk for having autism are evaluated sooner, it actually reduces their overall medical cost per child for the year preceding that diagnosis. So in general, when we can get patients through this evaluation process, it's having a benefit for the health delivery system and the cost of providing care to these patients. So what we have developed and delivered through a cohort in the metro area is a multi-step training. It is specifically targeting primary care providers of various types, but we are not right now training allied health, behavioral health providers. We're really focused on increasing the knowledge and skills of primary care providers. And the focus of the training is on young children ages 18 to 47 months with quote unquote straightforward symptoms of autism with some other exclusion criteria. And this is again really based on the data that exists from other states that have been doing this, that when you provide a really clear and focused inclusion criteria, it's really appropriate for the primary care setting for the diagnostic services. The training that we deliver is approximately 5 months, so it's a significant investment by the participants through varied learning modalities facilitated by multiple subject matter experts. It starts with a 2-day training where we are providing training on a specific diagnostic observational tool called the STAT, or screening tool for autism in toddlers and young children. Provide training in a very specific and structured way to interview for diagnostic for symptoms that meet criteria for diagnosis. And then we offer monthly 1-hour echo-like sessions over the next several months, where we're focused on both reiterating and strengthening the knowledge and skills that were trained in the first 2 days, as well as adding additional information to help primary care providers not only be feeling really confident in their skills in diagnostic evaluation, but also focusing on aspects that can help them continue to provide good quality primary care to those patients after or just as part of their overall care. So that is a ongoing learning environment that has been really well received by the participants that have been in here so far. I can see people putting some things in the chat. Sorry, I can't see both at the same time. So if you want to just interrupt me, you can. I'm almost done with slides though. So we are actually showing with the cohort that's participated in the metro area, we did some program evaluation work to really make sure we were able to demonstrate HealthShare's return on investment. We did this in a variety of ways, and we just wanted to highlight a couple of examples today that really showed that through our training, providers demonstrated increased confidence and knowledge base in order to do this diagnostic work. So they demonstrate significant gains in their ability to screen and identify, as well as to engage in diagnostic evaluations and their overall knowledge base around autism and autism care. So not only did we think this was going to be a good training, but our participants are sharing with us that they found it very valuable and demonstrated significant increase in their knowledge and skills related to our training. So to just briefly summarize, the benefits to primary care providers who participate in this training is that they gain knowledge and skills to directly evaluate children ages 18 to 14 when there is a question of whether a child may have autism through their practice. They also have ongoing access to a training network for ongoing support and collaboration. To participate in this training will result in being certified as in the STAT method of doing observational assessment and receive the kit for their practice. There are CME credits that are provided as participating in the training, and then there is a very comprehensive digital toolkit that we've created and we deliver to all PCPs that has templates for things like interviews, for documentation, resources for families, as well as providers to really help them, again, not only do the diagnostic work, but then support their patients, regardless of the outcome, in the most effective way. So we found PCPs really appreciate this really comprehensive toolkit to help them integrate this work into their practice. So that is just a brief overview. I wanted to keep it relatively brief so we really could focus mostly on questions. We'll certainly have some time for questions today, I think, but we'll also put, Lindsay, if you could put that email in the chat so that if people want to reach out to us afterwards, and I will stop sharing so that I can see people a little bit better. So I can see some questions were already being answered, but thank you, and we're happy to entertain any questions or comments that we can address.
Thanks, Kurt.
Did you take 2 big bites?
Before we jump into questions, I did just want to say, very excited to have this presentation.
Unless there's TV on, but he's not eating when there's TV on.
Hang on, I think we need to.
Then you go to school hungry. I don't care. You're not watching TV.
Okay. Thank you so much, Kurt and Lindsay, for being here to share that information. This is an aspect that the CAP has been engaging with Pacific Source and the council for going on about a year now. And I think it's at the recognition that we currently do not have providers within our community that are diagnosing for OHP members, which is a pretty big access gap. And so many of you have received outreach from myself to gauge your organization's interest in participating in a PCP cohort. And so we're still looking to gather organizations who are interested in order to work with Kurt and Lindsay at the OHSU Institute on Development and Disability to form a cohort for our region. So as we sort of engage here, be thinking about what questions your organization might have in terms of if you're a PCP provider, in terms of your willingness to participate in a cohort that might kick off in early 2025 to the early to midpoint of 2025. So with that, yeah, let me turn it over and open it up for questions. And I see that Manu, you've got your hand up.
Yeah, sorry, I'm off camera right now. I'm kind of feeling a little bit under the weather. So Kurt and Lindsay, thank you so much for presenting this information. As way of introduction, I serve as president of Capital Dental Care, and I'm a dry finger dentist. And so while this program that you've built and sustained within Portland is largely directed for PCPs, it would be, I would feel pretty honored if there's something that we can do to recommend integration into the clinical practice of dentistry to help with, at least referring to the PCP whenever something has been identified through an exam or an assessment that's performed. So looking forward to engaging further on it, while I realize you may not be privy to that level of information right now.
No, I appreciate those comments, and I think we all appreciate that it takes all of us across the entire spectrum of healthcare to help identify and support patients. And that's an interesting idea. Right now, as is, I think, clear, we're really focused on providers who practice as primary care providers, and the training is really developed around that. But I'm sure there are plenty of opportunities to look at how we help additional professionals screen and identify and help families on that journey. Right now, that's a little out of scope for us, but we'll keep that as a note for future thinking.
Thank you. And just kind of to put a pin a little bit more in it, and I realize my hand is probably still raised. We're also owners of ends with Care Oregon and Willamette. And so, definitely if there's of interest to expand on an idea of a pilot to integrate dental providers with this process, would be more than interested in engaging to see how exactly we could do that.
Great.
Thank you.
And I've got a question. This is Matthew Hatler. I'm a pediatrician at Salem Pediatric Clinic. And in the chat, I noticed Lindsay had answered Diane's question about the timing of the assessments. Is that a total of 60 minutes between two visits? So like two separate 30-minute visits? Or is that two separate 60-minute visits? That's the first question. And then the other question is, are nurse practitioners allowed to go through the training?
I'll jump in here. Hi. It is two separate 60-minute visits. That's based on the tools that are used for the diagnostic evaluation. There's at least 35 to 45 minutes for the DSM-5 parent interview, and then the STAT behavioral observational tool takes about 35 to 40 minutes as well. And then to answer your second question, yes, we do train nurse practitioners as well as PAs.
Great, thank you.
Thanks, Lindsay. I'll just add real quickly to that. One of the things I didn't highlight in my brief overview is that part of the work we've been doing in the metro region and through the partnership with Care Oregon is looking at a pilot for an alternative payment model so that practitioners are able to essentially be kept reasonably whole by this shift in practice, right? Seeing one patient for 2 hours is very atypical as a primary care provider, and standard billing likely will not capture that. So Care Oregon has been diligently working on a pilot for an alternative payment model that they have been starting to share out, and that as we're working with interested parties to join this effort, we are bringing this up with CCOs and other companies about how this might be important in order to help make this a sustainable practice within primary care.
That's great news. Thank you.
And as folks are thinking about other questions, as our region, as your organizations consider participation, we are leveraging our shared savings funds to fully cover the cost of this training for your organizations if you choose to participate. We also have that funding mechanism to consider support for sustainability and expansion of these services in your organization. So that's one aspect that we as a group and our Health Innovations and Investments work group can pull together a request that better supports this service, at least in the short term, as alternative payment methodologies may be considered. That's a funding mechanism that we can utilize to support this service in our community. Lisa, I see you've got your hand up.
Thank you. To clarify, does that include additional funds for the rendering of the services?
So the pilot that Care Oregon is developing is looking at what we have shared with them about what does it take to do this work? And then what are the standard billing codes that exist for primary care providers that align with that work? And where is the gap? And they are testing sort of a gap payment essentially, right? Like what's the delta between what would be typically covered through the billing codes and what does it take to do this work? And without getting too far into the weeds, because honestly, I'll get probably a little confused if I do, they're piloting a methodology that would allow this to all work on the back end, that if providers submit a certain set of codes, that would trigger the alternative payment so that there's limited burden on the practice to have to be summarizing and reporting out for this alternative payment model. We're still in the pilot phase, right? Care Oregon's been very clear this is a pilot that they're working through, and they are being generous with helping us be ready to share this out to other interested parties. But we're still working out all the details, but this is sort of the direction that it's going.
Okay, so Kurt, Lisa Ladd with WVP, IPA, Independent Physicians Association. So if we have practices interested, would it be reaching out for additional information from you for the groups?
Yeah, so I think you could reach out to us, and then we will coordinate with Care Oregon on like when and what can we share, because it's really their proprietary information. But that would be like, we're happy to help facilitate those connections. And as you briefly saw when I talked about the steering committee, Care Oregon is on the steering committee for this metro-based effort, and they are very excited about the possibility that this effort will broaden to be statewide. And so while they obviously won't be the partners on the insurance side for that, they want to, they've been, I think, clear that they want others to benefit from the work that they've done so far.
Thank you.
I meant to say something real briefly about the nurse practitioner or PA. That what you asked and what Lindsay said was true. I do want to clarify, though, that it's when they're practicing as a primary care provider. So as long as that's their role, that's typically who we've included. We will be open to exploring on an individual case basis if that's not exactly their role, to look at is their background and professional operation really align with what our training is set up to be focused on. So I don't want to discourage looking at that. Like, we would probably talk that through on a case-by-case basis.
Okay. Any other questions for Kurt and Lindsay?
I guess I do have a question, Kurt and Lindsay. Thank you guys for this presentation. This is a great opportunity for kiddos in Oregon to get resources and services. My biggest question, I guess, with the pilot or the participants that have already gone through, with the increased volume of kids that are diagnosed with autism spectrum disorder, are you finding that there's barriers to care or services then following the diagnosis? Like, maybe there's folks on the call that serve Marion Polk counties that can speak to that. I want to make sure if we have this plethora of new diagnoses that we have places to put them.
Yeah, so it's such a great question because ultimately, in my opinion, like diagnosis is really a pathway towards supporting the patient the most effectively, right? And getting the right mix of care services. So we spent a lot of time as a steering committee really thinking through like what's our scope and focus and how does it fit within the larger spectrum of care needs in this space. And we recognize that we are really focused on that diagnostic evaluation moment in time and are not beyond the training as part of the Echo-like series where we are enhancing and solidifying knowledge and skills for PCPs on helping support these patients. There is still an issue in Oregon of access to ongoing care that we are currently, while we are talking about that through some other mechanisms, like there's so much to do that we really wanted to stay focused on this piece of the work and recognize that it's not solving all challenges that exist in our healthcare delivery systems. So it's, yeah, that's a sort of a vague way of saying we're not really directly addressing that right now, other than the training that we're doing for the PCP participants around how they can support their patients.
Thank you.
Great. Other questions from folks? I know Melissa at Saniam, Prashanthi at WFMC, Michelle at Salem Health. Your organizations have been considering participation in a PCP cohort. Curious if any of y'all have any questions for Kurt and Lindsay. Not to put you on the spot.
I don't have any specific questions. We're just excited, and I think we do have two that primary care providers that want to commit to this.
Wonderful. That's so exciting.
And just while people are thinking to see if you have any other questions, part of what we're doing is having these kinds of conversations with different groups across the state. And we are working to try to sort of understand what is the readiness for groups to enter into a cohort, and then how might we pull cohorts together, right? Like it may be that your region identifies, we would suggest that a minimum cohort of 15 is an ideal because there's enough engagement and participation to learn from each other. We have capped it at 25. And so we don't anticipate any region really identifying 25 probably per PCPs, but we are working to potentially pull together people from different regions into a cohort if needed, although we will sort of keep working that out as it unfolds.
Great. And I believe right now as a region, we've got a pretty strong commitment from 2 or 3 PCPs, which doesn't sound like much on the surface, but when you consider that we don't currently have folks doing this in our community for OHP members, that's huge.
Mm-hmm.
It's huge for our region. And so we'll continue to try to get a head count of how many PCPs are interested and ready to move forward. And we'll continue that partnership with Kurt and Lindsay at the OHSU Institute on Development and Disability. Any final questions before we turn it back over to Bruce to move us forward?
One last thing, when would our cohort start if we were to get one together, just to break rough timeline?
A good question that I don't have a good answer to, because it really depends on like when we can pull together a cohort that can start. So we certainly are looking into probably late winter at the earliest that this would happen, but we're really, yeah, that's an interesting thing that it's been a bit of a jigsaw puzzle to try to figure out.
Kurt, I can tell you, my name's Jill Pearson. I'm a pediatrician in the Salem area. I don't currently have a physical building or an office. So if anyone on the call has a place that I could do these assessments, I would be very interested, and I don't mind traveling around. So Matt, if you guys have place in your clinic that I could poke and do some evals. Melissa, I haven't officially met you, but in your area, if there's office space that I can help, assess kids in the smaller towns, like that might be something that I'd be able to do. But EMR, something that's universally friendly with your toolkit, I think would be super, super helpful for me to be able to be a resource to the community.
Jill, I feel confident in saying yes, that we would have space for you if you were to come here to do that.
Awesome. Thanks, Jill.
Well, I know you all have a full agenda. Again, thank you for allowing us to come and share more about this project and for your questions and interest. If it will be helpful, we'll go ahead and send the slide deck to Jamal, as well as an FAQ that we've developed in case that helps you all continue to think about this or to continue to have conversations with your constituents. Is that okay, Jamal, for us to do that through you?
Yeah, that'd be great.
Great. Okay. Well, have a nice day, everyone. Thank you.
Thanks all.
Thanks so much. And Bruce, before we move forward to our general updates, Lavinia has a late-breaking announcement or request for the group. Lavinia, did you want to chime in?
Sure. Thank you so much for your time. I just wanted to announce that we are embarking on a research project. It's a research project looking at fall prevention programs and with motivational interviewing. So some of you may know that, I work with older adults and people with disability. So Northwest Senior and Disability Services has been offering a program called Otago, which is an evidence-based fall prevention program, which reduces older adults' risk for falls by up to 35%. And so what we're doing is a project with OHSU to research the integration of motivational interviewing with the Otago program. What we're looking for is a way to sustain the efforts that folks, when they go through our program, they learn the exercises and what we want them to be able to do is continue to do those exercises. So we're adding the motivational interviewing component. So I'm asking the group for referrals to the program. We're looking for those who are 65 plus, who are at moderate to high risk for falls, which would be as evidenced by, fall history in the last year and difficulty doing their sits to stand. So without using their hands, if they have difficulty standing up without using their hands, then that would be also an indication. And we and also that are somewhat homebound. So either through fear of falling or because they have that fall concern. So if we're wanting to start this program in January, so we're looking for referrals now. And I can send out a little description of the program and the how to make the referrals to our program. So there would be no cost, of course, to the participants. And everyone will be evaluated by a physical therapist and followed closely. So and all of that feedback would be provided to the referring party. So thank you for giving me this a few minutes, and I'll follow up with sending a research protocol description and referral instructions after this to Jamal. Thank you.
Thanks, Lavinia. And I do see Lisa with WVP said, yes, please, emphatically in the chat. So we'll be sure to collect that information from Lavinia and send that out to the group. Lavinia, please feel free to put any additional information in the chat that you'd like to share with the group or your contact information. All right, Bruce, back to you.
All right, so we are going to go through some quick updates. Just a reminder that we did vote. Yes, the online voting system is working. And we are moving away from possibly needing to do in-person voting, but we would like to welcome Melissa Bauer, Diane Bockingbird, and Jacob Lowen. I think I saw we had 2 of them on board today. If Jacob's here, the only one I can think of, he might be the numbers that's on here, but I don't know if Jacob's with us today. Anyway, we are excited to welcome our new members, and yeah, it's exciting. We're growing. Our diversity is improving because we are getting more thought processes coming in here. And I love the old phrase, "You don't know what you don't know." So hopefully we are bringing new ideas and new thoughts with each new CAP member. I do think Jamal said we're not going to get ginormous, but we love the growth. So with that being said, I think.
And just a quick plug as well, Bruce. We do have our CAP appreciation dinner on December 19th, which I think most of you have probably seen the flyer. We are excited to celebrate all the hard work that you all have done and the impact that you're making throughout the community. So we hope that all of you can attend. Please feel free to drop me an email to RSVP, or if you know that you're able to attend right now, feel free to even drop it in the chat, and we'll make sure to log that you'll be on hand for our appreciation dinner. Really hope to see all of you there.
Okay, so just be aware, we are going to be switching things up for our shared savings work groups, or not work groups, our work group. The name we've kind of decided to work with now is we're going to move over to the Health, Innovation, and Investments Work Group. That's because the Shared Savings Work Group has received an influx of more funding, so which is exciting. Our scope and our investment opportunities will be broadening to include the SDOH and the SEH QUIM funding opportunities. We've got some great stuff. That's where I was hoping Jamal was going to jump in for me to describe it a little bit more. I was excited to announce that exciting party next month. So I do want to give recognition. I believe it was Noel at the last meeting who had asked the important question of, hey, it feels like we're double voting. Jamal had a wonderful answer. And then, as I had described in one of my recent emails, we meet on a regular basis, and it's been kind of decided that, yeah, we think we can go ahead and switch over to an online voting only. If there is a moment where people feel that we need to discuss and vote in person, you will be able to have that opportunity as well. But that is something that we are truly looking forward to. Jamal, do you want to comment on that last part?
Yeah, certainly. So in the interest of expediency of our process and being able to more rapidly drive our investments out into the community, we're looking at a myriad of ways to sort of improve the timeliness of the process. So as we've brought in new funding for the SDOH screening and referral QUIM, as well as the social emotional health aspects of kindergarten readiness QUIM, that's a mouthful. We're evaluating and revising the criteria with which we review these applications, and also the processes that we use to approve applications and drive these fundings out into drive the funding out to the community. So one of the clear areas of feedback that we got from this group and other stakeholders was simply the need to remove the double voting. As many of you can attest to, you've seen the online voting form. In fact, I think one is live right now for WFMC. So we've got a slide in here as well, just kind of reminding folks about that. And then also sort of following up with our in-person voting. We felt that was redundant, and in case there is a strong indication from any member to have that in-person vote, We'll just sort of conclude things with that online voting form, which allows folks to review the details of each request, each initiative, comment, and submit any additional questions to the work group that folks want to consider, and log your vote or your abstention from the vote. And then we'll simply follow up at each successive CAP meeting to report out on the results of those votes. So that change takes effect immediately, and we'll certainly follow up with the CAP on the larger revised evaluation criterion process as we bring in the SDOH and SEQuIM funds. And so with that, we do have an initiative that's live right now from the Willamette Family Medical Center. Voting for this initiative will conclude on at 2 p.m. on December 3rd. Thus far, we've only got 5 votes from folks. So if you haven't yet voted on this one, and you are a CAP member, I know we've got many guests with us today, but if you are a CAP member, please use the link in the email that was sent to you to review the initiative, submit any questions that you have or comments, and log your vote. And we will finalize voting on this initiative by the 3rd.
And Jamal, can you resend that today, just so that way, in case people didn't catch when the vote went out?
Yeah, certainly. Make sure that people have that link. Okay. Questions from the group on the initiative that's live or the upcoming revisions to the shared savings work group, which is now our health innovations and investments work group?
I have a question, Jamal. Just a point of clarification, is Willamette Family Medical Center FQHC? No.
No.
Okay, thank you.
Other questions from the group? All right, back to you, Bruce.
Well, it looks like before we head on over to review the QUIMs with Pacific Source, and it looks like Chelsea's going to be taking over I think we originally had Zaira on for that, but before we do, I'd just like to take a couple minutes here because it looks like we are rounding out our last meeting of the season. And even though I did not have the opportunity, see, this is where I want to tease Naomi, to create a wonderful goodbye video. I did want to thank everyone for my time as co-chair and leave on a positive message, which is that each and every one of us has the opportunity to make positive change to those around us and those in our community. And I hope when each and every opportunity comes that we choose the positive route. You know, it's a wonderful time of year in the spirit of the holiday season. I do want to recognize a couple wonderful groups that I have been able to work with, family members and youth groups, the Marion Polk Food Share, or executive teams that would love to go out there and help. They are feeding those that are hungry. And the Church at the Park over there off Portland Road behind Catholic Community, they also do wonderful work with the housing displaced. It is a wonderful time of year to have a positive impact to those in our community. So I want to thank you all for my time. You've had a positive impact on my life. I do look forward to continuing to working with each and every one of you. And I'd like to work with more of you. I believe that partnerships are the positive change that we can make in our community because they're stronger. And together we can make our community stronger. So with that being said, that is my farewell and thank you to all of you. I did just get beeped because I've got patients going on right now. So Jamal, I'll let you take over. I'll try and hop in between my last patients here.
Sounds great. Thanks, Bruce. And we're not going to let you go too soon. We're going to have Bruce on hand at our appreciation dinner where we'll be going over some awards and celebrating the work that you all have done and the important contributions of our co-chairs, Bruce and Dr. Naomi Biggs. And we'll try to get her on board for that dinner as well. You won't want to miss it. we'll also be announcing our new co-chairs for 2025. So that'll be an exciting dinner as we chart the course for the next chapter for the clinical advisory panel. So again, hope to see you all there, and we'll save the farewell for Bruce to as our co-chair for that dinner. Okay. Why don't I turn it over to Chelsea with Pacific Source to kick us off with the quarterly performance report on our QUIMS.
Yeah, so good morning. I actually had it flipped the other way around, but we can definitely go into performance first. So just wanted to do a quick overview of kind of where we're sitting right now with the 2024 QUIMS. We're actually looking pretty good. Of course, there's some opportunity, and we definitely have some lessons learned from 2024 going into 2025 on some things that we know we want to work on, and we'll be, of course, engaging all of you in some of that work. For example, we really want to work on the initiation and engagement measure for the substance use disorder. So that's something that we have a lot of work happening internally, and we'll be rolling out some changes in 2025. That's one that year over year we are seeing a negative trend. So we really want to make sure that we have identification of what's taking place there, doing a real root cause analysis, and making sure that we can make some improvements going into 2025. As you can see from the year over year trend with the green arrows, there's a lot of these measures that are actually trending better year over year, same time. So that's a really positive thing. That has been definitely the reflection of this community and everyone coming together to do this work. So really just wanted to thank everyone for the work here. Are there any specific questions on any specific measures? And then there's one more page because this is not all of them, obviously. Some of the upstream measures we do not have, of course, current results on, but we are looking pretty good and on track for majority of those. Again, the only ECQM that we're seeing a trend in the negative direction year over year is the SBIRT 1.
And Chelsea, can you talk about any of the QUIMS that we're at risk of missing as a region, and strategies for this region to not miss them?
Yeah. So right now we're kind of on that cusp, right? So we're looking really good with a lot of these measures. A few of them, I would say they're right on the edge. So one that we really want to focus on for right now is the well child visits. So we're right at like, hey, we're not quite there for performance. We are trending better year over year, but we know that the target also improved or increased. So we want to make sure that we're getting any child in that's between the ages of 3 to 6. There's a number of different initiatives and work going on from the PCP groups and the pediatric groups. So just really anyone that doesn't have their schedules full for the month of December, that's really what we're looking at. It's pretty late in the year, but we do have a number of things happening right now. Our care management teams are also doing some outreach for some specific kiddos within the well child visit, as well as the childhood and adolescent immunization metrics. Really, those are the kiddos that we know, hey, they have only one more immunization that they need to get in. So whether or not they've had the reminder from their PCP, we're just making sure, hey, do you have a ride? What are some of the barriers that you may need? So our care management teams are reaching out directly to them as well.
Got it. Thank you. And can you talk a little bit about postpartum care? It looks like there's a relatively high need to treat number in the far right column. Is that where we're feeling confident about our region's ability to meet that?
I think this is where it's hard to say confidence in this measure specifically because it is a hybrid measure. So we are going to get chart review. Typically that bumps up our rate really pretty significantly. So of course we would like to see those penny claims. We've been reminding providers of that throughout the year. But really this will be in the beginning of the year, sorry, something in my throat. In the beginning of 2025, we'll be doing some chart review. I think we've actually already started some where we have some EMR access to go ahead and pull those charts. I would say that while our confidence, or while the need to treat is pretty significant, our confidence is relatively, I wouldn't say high, but we have a strong confidence in this measure. Diane, it looks like you also have your hand up.
I do. I put the question in the chat, but wasn't sure if you'd be able to see it. So year over year, the three that have the red arrows down are substance use disorder related. And if that's year over year, what are you seeing as the impact or cause of the downward?
Great question. We're still really in the analysis phase of that right now. A lot of that has to do with access. A lot of that has to do with timely care coordination and communication between entities. So we're really looking at, hey, what have we identified as the root cause? So there's a number of things that we're examining right now. I wouldn't say anything that we're saying, hey, we have statistical relevance that this is the absolute root cause, but we will continue to do that evaluation and share with this group.
Other questions for Chelsea on our QIM performance? Okay, hearing none. We do have this latest, so I sent out to the group the claims-based measures, if you will. There's probably a better term for that. The claims-based performance. We do have the latest ECQM that Samantha at Pacific Source recently sent our way, so I'll provide this to the group as well as we follow up after the meeting. And if there are no further questions for Chelsea on our QIM performance, I'll move us forward. Okay. Chelsea, I'll turn it back to you to talk about the dual eligible special needs plan.
Yeah, so this kind of goes hand in hand with what we just talked about in terms of our QIM performance. I just wanted to talk about and give a reminder for those that aren't aware of what the dual special needs plan is, and kind of who that impacts. Because when we're looking at that, we're not only looking at the Medicare Advantage membership, but also, of course, the Medicaid membership. So, of course, too, I'm sure most of you, if not all of you, are aware that a dual special needs plan is a type of a managed care plan for Medicare Advantage that really we're targeting some very vulnerable members who qualify for both Medicare and Medicaid. And so this is really an opportunity for them to have really integrated care management. They have a number of additional benefits when they sign up for a dual special needs plan. So it's something that we do encourage those members to look into if they qualify for both Medicare and Medicaid. So first off, wanted to just make everyone aware of that, that we do expect some growth in 2025. We have offered this plan in this region this year and going into, of course, 2025. The next slide, just as a reminder of who really qualifies for that, they have to meet the requirements for the full benefit for Medicaid, and they have to be enrolled in both Medicare Part A and Part B. Having a chronic condition alone does not qualify them for DSNP. But again, I would encourage, just like if there's any information that patients are looking for, to have them reach out to us. But really, one of the main reasons that I wanted to bring this topic here is because of the unique qualifiers and the vulnerability of these members. So we really want to work with our groups on, hey, what's some strategies? What are some things that we can do that's different for this unique population as they're falling into, and we'll go to the next slide here, Jamal, as they're falling into both our Medicare Advantage STARS program as well as our QIM performance. So I'm not sure that everyone is aware that they do meet the requirements to fall into that QIM program, as well as, of course, our Medicare Advantage STARS rating. And so when we think about that, there's a number of different things that we have oversight for these members, but we also have a number of integrated services, and we have a specific care management team that really just focuses on this population. So wanted to just talk about that. Any questions, any thoughts on this population?
I do see that Diane had a question in the chat. And that question was, is Atrio still offering the Medicare Part D part of DSNP?
So I was not able to confirm that. Based off of what I know at this point, Diane, I have heard they are not, but I have not been able to confirm that.
This is Lisa. I can jump in and help with that. Atrio is no longer able to provide the DSNP product in Marion Polk counties for 2025. They did file with, they did file for a crosswalk plan of a CSNP for specific, very limited chronic condition coverage, but they are no longer able to have the product for the DSNP in 2025.
So I have a question about that. And the reason I'm asking is because we obviously have clients we serve at OYN that are DSNP and show to still have Atrio, which makes sense if they're not going to be able to, they're still providing it right this moment, but right in a few weeks, they're not going to be able to. Will those people, Chelsea, will they auto switch over to having both Pacific Source, or do we need to be encouraging our clients, and that would be probably for everybody else on this group, to call Pacific Source and say, hey, I have Medicare and with another company, but I have you for Medicaid, so can I get on plan, or what do we do there?
Yeah, they will not automatically go into our DSNP plan, right? So they would have to enroll. That's something that they would have to, whether they connect directly to us or through a broker. Absolutely encourage that if they would like to have that coordination of benefits and have it more integrated, for sure.
So there won't be like a list share of members from Atrio that will be coming off DSNP because they'll no longer have it, but Pacific Source has it for a reach out, or no? We can't reach
No,
out.
they would default to dual, because of course they would qualify for both their Medicare and Medicaid services through us. But we wouldn't have all of that information to be able to do the outreach.
Thank you.
Diane, this is Lisa again. The brokers are aware in the area of this transition, so they'll be helping the members as well.
And really, from a care management standpoint, the coordination of those benefits, and it really benefits the patient, and that's really what we want to have that conversation about.
So Chelsea, this is Lisa again. Am I hearing you correctly? While there isn't the active outreach to contact the members, the default protocol will be, because there's the dual offerings through Pacific Source, that the members would switch.
Of course, we've done education to the brokers, and we've connected directly with brokers. But yeah, we would need them to enroll. They don't auto enroll. They actually have to enroll themselves. Yeah.
Okay. We'll make sure we're getting that message out to our primary care practices as well.
Yeah, I think of the different day-to-day challenges that people who are eligible for DSNP experience. There's going to need to be some care management and coordination involved in making sure they get transitioned, I think. So, and I'm not saying from Pacific Source, but maybe that's part of what the brokers are going to do. So
yeah, and Atrio did send a letter. Atrio did send a letter out to the providers. Now, whether they all saw that or not, but I have seen a letter that went out as well.
Once we see, you know, the membership, because they can enroll at any time, but as we see the membership change over time, we can also just notify this group.
That would be great, Chelsea, and I'll make sure to send out any information you'd like to provide to the group out to all of our members.
Yeah. If you have any questions, please do feel free to reach out to us. I can make sure to get you connected to the right teams within Pacific Source. I might not have all the answers, but we definitely have the teams that do.
Great, thanks so much. Thanks, Chelsea. Really critical information that's going to assist in the care of some of our most vulnerable members. So appreciate you joining and sharing that information. And to all of our members, we'll make sure to send this information out following the meeting. Geez, that's really all that we have for today. We'll certainly give folks back a big chunk of your morning here. But just as a reminder, you know, we hope to see all of you at our CAP appreciation dinner on the 19th. Feel free to drop me a quick email RSVPing for that event, or drop your name in the chat, you know, just to sort of indicate that if you intend to attend. Also, we've got our shared savings initiative from the Willamette Family Medical Center, which is live for your vote. So please access that online voting form and log your vote. I'll go ahead and provide that once again to all of our CAP members for your easy access. As well, we had our just a little bit about some of the initiatives that you all have been funding through your votes and your considerations and your insights. One of the events that we put on last week was our Building Connections across perinatal care providers and support providers, a community conversation, which was a really great interactive webinar that many of you attended. So many great insights coming from the community and connections being made. Folks understanding how better to connect pregnant women and families with behavioral health supports, social supports during the prenatal and postpartum period of care. So we'll continue that initiative in the new year, where we bring together those folks for an in-person networking event and explore digital resources, whether it's an online directory or integrating Unite Us into EHRs, where folks can sort of coordinate those referrals a little bit more seamlessly. That's some of the work that's upcoming for the Building Connections Across Perinatal Care initiative that you all have been instrumental in driving investments into. Lastly, just another quick plug, and thanks to the OHSU team, Kurt Freeman and Lindsay Blankenship, and to those of your organizations that again are considering offering, getting trained up and offering autism diagnosis services for our members, OHP members in our region. Please, you know, reach out to me if you've got interest, or if you've got any number of PCPs at your organization that are interested in participating. As soon as we've got a final head count of participating PCPs for our region, we can take that back to Kurt and Lindsay at OHSU and confirm our spot and ensure that we're prepared to participate in that cohort, and that it's fully funded through the shared savings funds that we have available to us. With that, I will stop rambling and thank you all once again for your time and your important contributions. We won't have a December meeting, but again, look forward to seeing all, if not most of you at our CAP appreciation dinner on the 19th. Thank you all so much, and we'll be in touch soon.
Thank you.
Take care.
Thank you, everyone. Bye.
Thank you.